the final episode of Everything You Need to Know About Clinical Trials, we will talk about common myths and questions that come out when patients hear about clinical trials. So one of the common myths that we hear is that clinical trials are a patient's last resort. This is not true. In fact, many trials are open to patients at earlier stages in their cancer journey and may even offer better options than current treatments. Another common myth that we hear is that you might get a placebo or no treatment at all when you join a clinical trial. This is not true. In trials, you will often get the standard of care, and in the rare case that the trial includes a placebo arm, meaning one of the treatment arms of the study will be receiving a placebo, this will be disclosed to you in the informed consent process. So you will have all the information that you need to determine whether you want to join or not if there is in fact a placebo involved in the trial. Another common myth is that clinical trials are unsafe. This is not true at all. In reality, trials go through very strict review through what is called an IRB. This helps ensure that patients who enroll in the trial are kept safe and that their information is kept very, very safe. You will be monitored very closely and sometimes even more regularly than you would if you were receiving standard of care treatment. Another common myth that we hear is that you'll be treated like a guinea pig. The truth is, patients in trials are treated with great care and respect. And as I mentioned, they often have more frequent care than patients who receive standard of care treatment. Now, for some frequently asked questions that we hear about clinical trials are, one, can I leave the trial if I change my mind? And absolutely, this is the case. You can always stop at any time and your care will continue. So if at any time during the trial, if you feel as though you no longer want to participate, you can always stop and leave the trial. Another common question is, will it cost me extra? So most trial related costs are covered by the trial sponsor, and some of them are covered by your insurance, but you should always ask your team and they will let you know what costs you would have to incur as a part of joining a clinical trial. Another common question is, will I see my regular oncologist? And the answer is yes, your doctor should stay involved throughout the trial. You may see new doctors that are part of the investigational team if your regular oncologist is not one of the investigators in the study, but your regular oncologist will continue to be very involved in your care. Another common question is, can I continue the treatment after the trial ends? And the answer to this is sometimes, especially if it's helping. As I mentioned in other episodes, if we see that there is intolerable toxicity or if we see that the cancer is getting worse, then at that point, most likely we will discuss coming off the trial. But if the medication is helping and is well tolerated, then you most likely will be able to continue on the study.